Dr. Gurdeep Sethi is a triple American board certified medical oncologist and director and co-founder of Millennium Oncology India Private Limited. I have met Dr. Sethi in his center, and what I can tell you everyone is that he's so passionate about preventive oncology, which is so rare to see in today's time, that despite spending many years as an oncologist, his heart is in preventive oncology. His heart is to actually ensure that the patients don't get cancer and they can be saved. And because of that, his passion, he has returned to India despite having a flourishing career abroad to make sure that India, where his heart resides, the Indians can prevent cancer. The cancer statistics in India are rising day by day. And of course, we know the reasons. But today in our conversation with Dr. Sethi, we'll be talking about a lot of optimistic things which is happening in the area of cancer. A lot of things which actually will give you hope. And not only hope, but actually give you those solutions so that you don't become a cancer statistic. So welcome to the show, Dr. Sethi.
Thank you. Thank you, Dr. Shikha. Thank you for the kind introduction. I'm really honored to be on this session. So I've been a medical oncologist, hematologist for over 40 years now. And I went through my med school here in India. I did my MBBS from DMC Ludhiana and did my house job in Chandigarh. Went off to the US and did my residency in internal medicine and then fellowship in hematology oncology in Chicago. Taught there for 2 years and then went down to Houston, practiced for 16 years. Now, I came back to India to help my dad, and he asked me to stay and help people out here. And in the last 8 years, 9 years, I've seen that most of the patients that come to me are stage 4 cancer patients, late stage patients. And they've been through a nightmare of treatment, procedures, costs, and a very tough journey. And 90% still don't make it. So we have in the US where we see that there is a program, there's a structured program where we try to get things tested, checked on, and catch the disease early. With that in mind, we've had the chance to bring a new program from Germany, which is a Phantom Detect blood test. It's a blood test that can detect cancer early in anybody. And this way we can catch them in stage 1, 2, and take care of them and prevent all the nightmares that I see. This is something that I've now been passionate about in bringing it across to India so that we can bring it to everybody, a simple solution to catch things early so that we don't go through all the pains of suffering of late stage disease. I feel with this, we'll be able to save millions of lives and livelihoods. Thank you.
Absolutely. No, thank you so much, Dr. Sethi. And I must tell our audience that 2 things. One is that I got that test done, and it is a screening test. Means that it is not that you have cancer, but your risk is increasing day by day. So that means you are luckily one of those lucky ones where you can find out if your risk is so high that you need to change your diet and lifestyle. And when I got the screening test done, of course, I was counseled that don't worry if it comes positive, because that means that your risk has increased, not that cancer has come in your body. It's just that the risk is increasing. And of course, that really helped me to understand it even better. And of course, when the test became negative, I was even more enthused that I have to continue eating right and living a balanced lifestyle, which of course we'll talk through the program. But Dr. Sethi, I want to ask you that, there are many tests available and most patients are confused because when we talk about the cancer detection test, they imagine that means they have cancer. So this test is very unique. Can you just explain why is it so different from those tests which actually detect actual cancer, and this test which helps you not get cancer in a way because of the way it is done?
See, if you look at cancer, cancer is a very silent killer, if you can say it. And the incidence and the prevalence is just going up. It's increasing every day. Okay. If you do the look at the statistics, WHO says 1 out of 10 Indian is going to get cancer.
1 out of 10.
Yes. The population of India is 1.4 billion. 1 out of 10 is 140 million. And today, the incidence is only 1.4 million. So we're seeing 1% of the problem. Truly, this much more is not reported. ICMR says, nope, it's not 1 out of 10, it's going to be 1 out of 9. So the number is even higher. And they predict that in the next 5 years, the incidence is going to go up by 30% of most of the common cancers. So if you look at cancer, at early stage, there are no symptoms. There are no symptoms at all. You cannot tell. When you have symptoms, you're already in the late stage. You cough up blood, you go and get an X-ray, there's a big mass in the chest, it's already spread. All right. So we don't have structured screening. We don't have ways to screen. This test is a screening test. It's not a diagnostic test. Most of the tests that you see in the market are tumor markers, which are used only for surveillance in the US. Okay. If you have colon cancer, we check your CA. If that's high, then we follow it at the treatment and make sure it comes back to normal. It cannot be used as a screening test, but in India, it's being sold as packages as screening tests. So sensitivity is lower, specificity is lower. This test developed by the Germans looks at 2 biomarker proteins which are present in all cancers. If you look at cancers, we have 200 types of cancers. Okay. And the screening technology that we have, real screening, are only for 6 types. And each screening is for one type of cancer. So for mammogram, it's only for breast cancer. Pap smear is only for cervical cancer. So similarly, colonoscopy for colon cancer, PSA for prostate. So 6 cancers we can do something about. And in spite of having that, sensitivity being around 70%, 60, 70%, we're still very underused because there's no structured way of doing it. Very few people go and get mammogram. Nobody gets a colonoscopy unless it's compulsory or they're bleeding or having an issue. In the Western countries, this is compulsory by insurance. So they do it once a year. Once they reach 50, everybody gets it done. So based on that, since there's a structured program out there, driven by insurance, and there's awareness, there's better screening, and we catch people stage 1, stage 2, and we cure 80% of them. In India, everybody's presenting stage 4, so we're curing around 20%. So that's the big difference. So this test, compared to other tests that we have in the market, it's a screening blood test, which is universal for all cancers. Okay, so 200 types of cancers, out of which 92% are solid tumor cancers. Carcinomas, sarcomas, 92%. Leukemias, lymphomas, blood cancers, 8%. So this covers 92% of the cancers. If you're positive, means there's something growing in the body. There's a tumor somewhere. Then you go get a PET scan, find where it is, get a biopsy, get your tissue, then get your treatment. Our goal is to be able to catch them in stage 1, stage 0, stage 2. This way, all we have to do is cut, cure. We may not even require all the extensive treatment after that. That's the beauty of this test.
Absolutely. Like you very, correctly pointed out, catching at stage 0, which means that cancer has not developed, but your risk has gone up. And through the screening test, you already know that if you continue your lifestyle and your nutrition the way you are, the risk is going to convert into a probability. And that is why these screening tests are so important, because true prevention is preventing the disease. And so this screening test is one of the amazing screening tests which helps you actually prevent the disease rather than when you have the disease, then you are taking some precautions or something. So I think that was really important, because most people are very scared. What I've seen, doctor, in India, and I'm sure many other countries, people say if we do a test, kuch nikal gaya, to it's bad news. But here, it is good news because which means that it's only telling you a risk. It is not saying you have cancer, but your risk has gone up and therefore change now.
No. There are two levels that we do. One, I have a multi-risk cancer assessment, which is a questionnaire that you do. Okay. So those questionnaires looks at the common causes of cancer that we see. So we have around 8, 10 causes that can be controlled and 2, 3 causes which we cannot control. So if you look at number one is tobacco. Tobacco is the main cause of most cancers. Whether you chew it or you smoke it or you put it in your mouth as a gutka or whatever, whichever way, all right? Tobacco, 12 different cancers. Alcohol, 7 different cancers. In the US now, all new labeling of alcohol bottles will have, it can cause cancer, like tobacco, all right? They've now accepted the awareness. So it's an accepted social drug, okay? It's accepted. However, now we're recognizing the long-term big effects. So people are being told moderation or stop, all right? Then we have obesity. That's so prevalent now in North India. And obesity is causing as many 10 to 12 different cancers, catching up with things. And obesity is being brought in by the processed food that we eat, the junk food, Zomato, Ziggy, quick deliveries. We don't cook our traditional food anymore. We've forgotten our organic traditional food. So that's where Dr. Shikha comes in to help us in all that stuff, right? So definitely, these are the big factors. If you have some infections, HIV, hepatitis, those increase the risk. But that's something, again, all these factors that we talked about also can cause diabetes, and diabetes also increases your risk. Inflammation goes up. Also depends where you work. If you work in a factory where you're exposed to chemicals, toxins, then you have a higher risk. So these are the risk factors that we go through. Are you active or not? Are you exercising? Or you're sitting all day? These are factors that come. These are controllable factors. Then we have factors. I'm living in Delhi. The air is polluted. I can't move to Switzerland. All right. So I can't do that. Or there's a family history. Or I have an inherited gene. Those are inherited factors I can't do anything about. So this questionnaire that we go through, we ask all these questions and look at certain subtle symptoms of cancer. Those are also checked out. And based on the questionnaire, you have a report in a minute after you fill out the question. And that will tell you whether you're at normal risk, low risk, no increased risk, you're normal. Or if you have a high risk or very high risk. And based on your high risk or very high risk, then you're recommended to go and get a Pantum test. Pantum is the blood test that we're doing, which screens for cancer. Okay. One is the questionnaire if you have a risk. A second part is if you do have the tumor or not. Pan tumor detect, Pantum. Okay, that's what it is. So the two components. One is a multi-risk cancer assessment, and the second is the multi-cancer early detection test. So that's what it is.
Absolutely. So tell me, doctor, that if people don't get such tests done, and there is, as you said, most of the risk factors are there because air pollution, water pollution is there, then smoking, alcohol, all of that I think many people are doing. Even if people are not smoking, the alcohol is there, the junk food is there. So what really happens when people are not aware and people are not doing any early checks or screening checks?
So what really happens? I had a gentleman that came into clinic today. Looked pretty healthy, looked fine, active, from a tier 2 city, but he was jaundiced. Okay. And not only jaundice, very high jaundice, yellow, but still walking, talking around, and all that. And a week ago, he had thrown up blood.
Oh.
Okay. So prior to that, he had no issue. He had no idea at all. So he has a tumor in the stomach, in the duodenum, which has blocked up his bile duct, it's spread to the liver, and there's disease everywhere. So people present when you have symptoms. Now he got screened 6 months ago, 1 year ago, we already got that. He's already stage 4. He
Stage
still
4.
looks, he's already stage 4. There's spread to the liver. He's jaundiced because the liver is blocked up. Okay, liver's failing. The Anderson still doesn't have symptoms. Sitting pretty comfortably, pain minimal, just threw up one time, and that's where the whole thing precipitated. And now he's come for help. And because everybody's given up, he's severely jaundiced, there's nothing to do. So he's come and says, Doc Saab, can you do anything? We are really stumped, very late stage. Okay. So people will present at late stage if they don't get checked. And when the symptoms come, late stage, stage 3, 4, most of them, that's when they have the symptoms.
Absolutely. So if one is screened on time and detected, one can change the entire course of disease. One can actually prevent. But if one loses that golden opportunity, that window or period, and ends up with the tumor growing inside the body and God forbid progressing, then it's a very different, very different path.
The outcome changes. If you look at all cancers, technically we can cure all cancers. The 200 cancers, we can cure them if they're stage 1 or 2. Okay. So stage 1 cure rate is 90%. All cancers, all comers.
Wow. So stage 1 cure rate is 90%. Wow.
All comers. It doesn't matter what type of cancer.
Okay? All cancers.
Yeah.
And I hope people are listening, and especially people who might have had a family history of someone in the family getting cancer, that stage 1 is 90% treatable. So
yeah, not so. So some are higher at 99%, but most, if I'm taking all cancers 200 times, cure rate is around 90% if you're stage
1. Amazing, amazing.
Stage 2 is around 70%.
Stage 2 is 70%.
Stage 3 is around 50%.
So stage 3 is 50-50. It's literally like a game of dice. Okay.
Okay. And stage 4 average 15%.
1-5. Oh my God. From 90% at stage 1, it is 15% at stage 4.
So
it was captured late. It was detected late.
Right. So to easy balance to understand, 85% cure rate stage 1, 15% cure rate stage 4. 85-15 ratio. Either way, which way you want to go.
Amazing. Which really means that why don't people get get these tests done more often? Is it lack of awareness, or is there a fear? Because
both components out here. There is a strong, firstly, there's lack of awareness, and there's no structured healthcare. All right. We only go to the doctor when we're sick.
When we are, by the time it's too late, yes.
You tell me, even in your family, even your loved one, you have so many family members. Do you really believe everybody's been to the doctor to get your BP check and everything done?
No. In fact, blood pressure check also has come of age now. Initially, people landed up with a high BP in the ICU and then discovered they had high blood pressure. So
I hear stories every day now since I've come back that saying, Dr. Saab, I've never been to the hospital. 80 saal ho gaya, hospital nahi aayega aaj tak. And the day I land up now, he's got 10 diseases. I'm diabetic, I have high blood pressure, I have heart disease. I was happier not being in the hospital. But you didn't realize you already had all this stuff. You were never checked.
Yes.
Now you come in the ICU with all the complications. Okay. And then 5 days later or a month later, he passes. Say, no, you're so healthy. He went to the hospital and died.
Oh, without realizing that all those diseases actually were in his body, and he didn't realize it.
Yeah. So those are for other disease. Same is happening for cancer. People won't go until you have symptoms. Our job is to bring the awareness. People should be aware that we have structured programs, we have medical checkups, we have easy checkups. Okay, I don't want to get a colonoscopy done, means I have to be admitted, I'll have to be put under anesthesia, they'll put a colon, it's invasive. But I can do a simple blood test. It tells me.
Yes, in fact, doctor, I wanted to ask this question only. If you can explain what is this test actually and how is it done?
So the test is called pan tumor detect. It's a simple blood test, a small tube of blood, which can be collected from home, like you do your CBC and chemistries and your cholesterol check, sugar check when people come home and draw your blood. This can be done from there. So it's a simple blood test. And in this blood test, we look at your own immune system that has done a biopsy already of your tumor. And there's special cells that do that. These special cells are called macrophages, which are part of your white blood cells. The macrophage leaves your blood, goes into the tissue where a tumor is, does its biopsy, comes back in the blood. As I said, there are two proteins that we look at. One protein is called APO10, and the other protein is called TKTL1. So these two proteins are present in all cancers with a common pathophysiology pathway that they take. So when the macrophage does the biopsy, comes back, we do special staining of those and proteins in the macrophage and run it through a flow cytometry machine, and then we give you a score, whether you're positive or negative. So if those proteins are present, then you're positive at a high level. If those proteins are not there, then you're negative. You don't have a problem. Okay. But the macrophages have to be intact. Your immune system has to be intact. Okay. So if you have autoimmune disease, if you had cancer, had treatment, then we don't do that test on you. You don't qualify. So we go through a questionnaire to make sure your immune system is intact. We go through certain questionnaire. And if everything is good, then we take your blood and then we run this test.
Absolutely. So like Dr. Sethi just mentioned, that it is a simple blood test. It's not a big, it's not some complicated big deal. It's just a simple blood test. And before doing the blood test, there is a questionnaire, which is, you can do the risk assessment through a questionnaire and then the blood test. And we are also offering a cancer prevention protection program, a cancer protection program in which nutrition and lifestyle changes we are offering, so that in collaboration with this test, we are ensuring that people can follow and change their nutrition, change their lifestyle, so they can actually get the result they are hoping for, which is protection from cancer and reducing the risk. So risk mitigation is very, very important. Now, over here, doctor, I want to ask one more thing, is that some people have heard about biopsies. So what is a liquid biopsy? What is a tissue biopsy? You know, these are some of the terms which are thrown around a lot.
So the true test that we've done all this time is a tissue biopsy. Okay. No tissue, no issue. Okay. Simple. All we have to see a tissue diagnosis to confirm that you have cancer. Right. Liquid biopsy is where we use your own immune system, certain cells, or certain proteins, which we catch in the blood, where we target our markers on and to see if they're positive or not. So there are 4 or 5 types of liquid biopsy. Okay. Ours is also a liquid biopsy. We're using your own blood cells, your own macrophages, part of the immune system, that goes, does the biopsy and comes back, and we're testing in the blood. Most common ones are looking at NGS, where they stain circulating cell-free DNA. So when the cancer cell breaks down, the DNA is floating in the blood. So that's where we take your blood and try to catch that DNA and then run it through gene sequencing. Then I'm able to tell you where the cancer even came from. Doesn't tell me the stage, doesn't tell me anything, but it does tell me the ontology. That means where the cancers come from. In our test, it's a pan-tumor detect. If you test positive, it means there's a tumor. You need a PET scan. The PET scan will define where the tumor is. You still need a tissue biopsy to confirm the diagnosis. In the NGS programs, in the CTC programs, in certain other liquid biopsies, you don't need that if you test positive. The sensitivity is much, much, much higher in our case. And that because the circulating cell-free DNA is so small in amount, the sensitivity is very low in early stage. Late stage, then it comes normal. And the cost is almost 5 times more.
5 times more is the other traditional cost compared to this.
That is
yes,
correct.
Yes, absolutely. I can. And that might be one of the reasons why people refrain from getting too many tests done. But since this is not such an expensive test, it is much easier to do the screening test. So, do you recollect any case study or anything, or can you share any case study where the patients got this done and they changed the course of their health and
So
actually.
we do have many cases that they've got the test done where they've tested positive and got scanned and got treated and been cured and are happy. Okay. We've also got cases where they've tested positive, and when we scanned them, we found nothing. They were right on the borderline. So our tests, we look at these two proteins, APO10 and TKTL1. APO10 is a marker for benign tumors. Normal cells have a lifespan. Cells are the basic units of growth and structure in the body. So when the cells grow old, they die. And that death is called apoptosis, self-destruction. Because of certain mutations that can be disrupted. So an endonuclease enzyme cleaves your chromosomes and the cells die. Okay. Because of a gene mutation, that doesn't happen, and self-destruction doesn't happen, and that's when the apoptosis is disrupted. That's caused by APO10 protein. It's a disrupted apoptosis program. So APO10 levels go high, and when APO10 level is high, you probably have a benign tumor. Cells are not dying; they're not multiplying; they're just not dying. They're collecting. The second protein is the transformation of malignancy. That means it's becoming cancerous, it's going to spread. So the TKTL1 is a hallmark of malignant transformation. Okay. So we look at these two proteins. If your score is high, 260 and above, you're positive, 260 and below, you're negative, 259 and below, you're negative. So I've had a person who came in at 260 and wasn't very sure, retested 261. We did a PET scan. We found nothing. Very upset. You wasted my money, you did this, you did that. I was so tense and all. I said, sugar ka kuch nahi mila. Thank God we didn't find cancer. 2 months later, I get a call from his wife saying, we want to talk to you. Doctor said, I want to talk to you. And I was worried. So she came in and she says, thank you, thank you, thank you. I says, thank you for what? He says, he's cuts down, he's stopped smoking, he's stopped alcohol, he's lost 20 pounds, he's active, he's become a man again.
Oh, wow.
So the risk factors, we tell them, please, these are risk factors. If you're 258, cut down the risk factors. And there's a component of inflammation with TKTL1. So that tends to come down. So I says, tell him to come back for a test later on. And he came back and he was 256, not positive anymore. Okay.
Amazing. Actually, that's true. And it's, it's so well said that most people are living a life where it's a risky life, if I can say. They're treating their bodies badly, they're ingesting the wrong kind of foods. And if a test can help them to change their lifestyle and actually prevent getting cancer, nothing like that. I think all the wise will come and thank you for being that that person who made them enlightened about their health.
And the gentleman never came back. He really was very upset. But I know he changed as a person.
But he changed. He changed for the better.
Yes.
He changed for the better. No, absolutely. I think this is a brilliant story because I know, because we get a lot of patients and it's a struggle to help them or to tell them to change their eating and lifestyle, because they feel nothing has happened, so it's okay. But
that is right.
Nothing has happened is just pure luck, because otherwise all the risk factors are there.
That is right.
That is why it's important to take that. So one more thing which I wanted to ask is that we know that there are certain, like for example, daily, the air quality index. So it's a very, very high risk zone. And similarly, I think a lot of North India is, in fact, from I think one of the cities in Punjab, there is a train which has been given a terrible name called a cancer train.
Right. So this train leaves from Bathinda side, that's the Malwa area of Punjab. The air is polluted from all the thermal plant blowout. The ground is polluted from pesticide. The water table is polluted. All right. So everything's polluted. So they all tend to develop. And the cotton industry is large out there. So there's spores in the air. People breathe it in. And the cotton ginning industry is high. So a lot of people have cancer out there. So they go there, the poor people, farmers, and also they get on the train and they go to Bikaner. 60% of the people in that train are cancer patients. So now there are institutes coming up in Bathinda, and a lot of Ludhiana and all that stuff. So most of the people are coming there. But that Bathinda train was standard before. Air is polluted. Water is polluted. Pesticides in the food. These are pesticides, and so these are poor folks who eat good food, whatever they can eat, right? But the food is contaminated with pesticides, right? They don't have the water to clean things properly. So they go, it's just the lifestyle. And then if they get into alcohol and tobacco, increase the risks even more.
Absolutely.
Yeah.
Absolutely. That's so true. Absolutely. So I think most of our questions we have already covered. But some of the things which I want to share is that cancer and all cancers, they are inherently treatable provided you are detected, and the earlier the better. And this test can really take it to very, very early stage. And of course, once there is a multi-cancer screening questionnaire, which is also available. The test is also available. And the entire program, which is the POM program, which is basically a program for onco-risk mitigation and management, we are launching together with Dr. Sethi so that we can actually protect and reduce the risk very much in time, so that people who even are having those risk factors, we help them mitigate, modify, reduce those risk factors and get the best quality life so that they don't become a statistic. Now, some of you who are interested to get the assessment done or get the test done, or some of you who are interested to actually join the program for risk mitigation and reduction, you're more than welcome. All of you can note down some of the numbers. Like, for example, if you want to reach us on our cell phones, the number which is 987-1100-237. So I'm repeating, the number is 987-1100-237. So you can WhatsApp, you can call, and we are here to help you. Dr. Sethi is located at Gurugram, and he's available. If in case somebody has already been detected with early tumor, you're more than welcome to reach out.
Oh, any stage, any kind of help I can
any
be
stage,
offered.
any help you need, Dr. Sethi is available. Yeah. And of course, for any tests, for any inquiries, we are all here. Please reach out to us, and we are here to save lives, because that's what was our when we became doctors. That's the oath we had taken, to help save and protect lives.
Right. Absolutely.
So with that, I'd like to thank you, Dr. Sethi, and some last words from you before we wind up the session.
Yep. If anybody has any questions, either you can send it by WhatsApp or text through our program that we have, or if anybody wants to ask a question, I'm open for 5 minutes. So if that's a part of the program, I don't know.
Yes. So over here, I just want to also ask Dr. Sethi that, when people get the test done and suppose it comes positive, what are the typical things going on in their minds?
So firstly, there's a lot of apprehension to do the test.
Yes.
If I don't want to know. I just don't want to know.
Yes.
I'll deal with it when it comes. Sadly, when it comes, then you're really desperate. Then you say, I should have done this before. The cost of treatment of early disease, average cost, just cutting it out, maybe some chemo radiation, maybe 50% you don't even need that. The average cost of that is less than 2 lakhs. And you're cured.
Right.
When you present with stage 4, the average treatment goes on for almost a year and a half, and you've spent around 40 to 50 lakhs and you're not cured.
40 to 50 lakhs. Oh my God.
If you have the resources, you'll be doing all that. And you'll be in the hospital, surgery, chemo, immuno, palliative, radiation, all that adds up. And it keeps going and going and going. Okay. And the suffering and the morbidity, that's not even included. Okay. So we don't want people there. We want them to get cured. Catch early, whatever it is. Thoda surgery kitta, you want some chemo, radiation, get done, get cured, get cured, get cured. So the goal is to catch early. All right, if there's any. So don't be apprehensive about testing. Don't be apprehensive. Go closing your eyes, hiding your head in this hand will not take the problem away. The problem is there. You don't have to wait for it to show up. You catch it before it comes up. That's what the main message is.
Absolutely.
Catch it early. Yeah.
Catch it early and save a life. Yes, yeah. Absolutely.
It's good to know you have nothing. It's okay to know you have nothing.
You have nothing. Yeah. Even if the test is positive,
No, but even if we do a test is negative, I'm very happy.
Yeah, absolutely. No, absolutely. Absolutely. The test is negative, it's even better.
Yeah, it's good to know you have nothing. You rest assured, test next year. You do your cholesterol tests. Why do you do it? It's heart disease. You do your blood tests every year. You check your glucose every year. This is also another check, part of the health check.
Absolutely. And I would say that, like, for example, all the mandatory tests which are there available, the executive checks, pap smear is a very important test. And it's also for early detection, and it has saved so many lives, which is a cervical test, pap smear for women. And similarly, when a mammogram is done, it is for early detection. So this is one of the early, tests it's a screening test, and it can really screen out populations and help them protect their lives. So thank you so much, Dr. Sethi. This was really, really nice. And of course, going forward, we'll be having some few more sessions where you are welcome to bring in your questions. If you have friends and family who might have had a disease, and a tumor or any other thing, you're more than welcome to reach out to us, and we are here to guide you so that you not only save your life, but you also save costs.
That's right. So remember two things. Continue with whatever you're doing in your life, where you get regular checkups done. Go to your doctors, get regular checkup done. Get all the screening programs that we have done routinely. Add this to that program, okay? And fill out the risk questionnaire. See where you are. Don't be afraid. Don't be afraid. This is something, as I said, stage 1, 95% cure rate. We can cure this, but we have to catch it early.
Catch it early. Catch it early and save a life. Absolutely.
Yeah. And then modify your lifestyle. The risk questionnaires are there. What risks are there? You'll understand. Once you fill the questionnaire, you'll know what are the risks. You'll automatically modify it.
Yes, absolutely. Like that gentleman.
You're doing it not only for you, for the future, for your children. Like one person gets sick. If he's the breadwinner, firstly, whatever savings there is gone. What about the rest of the family? They go below poverty line, boom. You see, livelihood is lost. Life is lost, livelihood is lost. Very sad. Can be prevented.
Can be prevented. Exactly. So you save money, you save life, and of course,
family, livelihood, everything.
Absolutely.
And cancer is not a one-man disease. It's the whole family. Everybody gets in there. Yeah, everybody gets pulled in.
Absolutely.
And you don't want that. You don't want that.
Yes. So in that mission for Dr. Sethi, we are supporting him so that he can fulfill his vision of saving more lives and not allowing people to end up as a statistic. So thank you so much, Dr. Sethi, for joining us today.
Thank you, Dr. Shikha. Thank you for...
And we shall take more of your time in the coming weeks so that we can educate more and more people about this wonderful test.
Thank you. Thank you all. All right. Good evening.
Bye.
Bye.